Welcome to the Mater Mothers Hospital Food, Fertility and You, a short presentation on the positive lifestyle changes you can make when planning a pregnancy. You may have been wondering if there is any special diet to follow that may help you to fall pregnant. You may have even increased or cut out various foods to see if it makes a difference. This short video will give you the most up-to-date information on diet and fertility. We draw our advice from many up-to-date sources including the Australian Dietary Guidelines, the Fertility Society of Australia, and the Fertility Diet Book. From the Nurses' Health Study, a very large study conducted over many years, we know there are a number of dietary strategies that may improve your fertility. The more strategies you incorporate into your diet, the lower your risk of ovulatory infertility. In this case, more is better. While this study specifically looked at ovulatory infertility, many of these strategies are also appropriate for ladies with other fertility concerns too. As each of the strategies are mentioned, think if this is an area you might be able to make changes in. More whole grains and low glycemic index carbohydrate, or low GI, and fewer highly processed carbohydrate. More protein from plants, less from red meat. A daily multivitamin that contains 400 micrograms of folate and 150 micrograms of iodine. Coffee, tea, alcohol in moderation, if at all, but no sugared sodas. Aim for a healthy weight. If above your healthiest weight, a loss of 5 to 10% can jumpstart ovulation and is good preparation for a healthy pregnancy. Physical activity, 30 to 60 minutes per day, and vigorous is okay. We will now step through most of these in more detail with focus on favourable food choices for fertility, aiming for your most healthiest weight, and setting your life up for exercise. Favourable food choices for fertility. To ensure you get all the nutrients, vitamins and minerals you need to help prepare your body for pregnancy, you should include foods from all food groups in your daily diet. However, there are a few specific food choices you can make to promote fertility. These include choosing carbohydrates that have a low glycemic index, for most people, including more protein from plant sources and less from meat, and keeping alcohol and caffeine to a minimum. Choosing low glycemic index carbohydrate. You may have heard of the glycemic index, or the GI. This describes how different carbohydrate foods raise blood glucose levels. Carbohydrate foods are ranked from 0 to 100. This measure tells us whether a food will raise blood glucose levels slowly, moderately, or quickly. In response to increasing blood glucose levels, the hormone insulin is secreted to remove this glucose into your muscles where it is used for energy. Low GI carbohydrate foods raise blood glucose levels more slowly over a longer time, and in turn, insulin requirements are more uniform. There is a positive link between this and improved fertility. In addition, low GI foods help reduce appetite as they keep you fuller for longer and may assist women who are above their most comfortable or healthy weight. Here are some low GI food swaps. Multigrain or rye bread rather than white or wholemeal. Crackers based on whole grains or seeds rather than highly processed biscuits. Pasta, noodles or basmati or dungara rice over white or brown rice. Sweet potato rather than white potato. It is important to remember when making your swaps that you should keep these to normal serve sizes and not increase the amounts.
In a large study conducted over many years, it was evident that the type of protein women consumed affected fertility. Consider where the protein you eat comes from. Is it mainly from animal sources like red meat, fish, poultry or eggs? Or do you include plant sources such as tofu, beans, peas, lentils, nuts and seeds? it is a good idea to balance your intake of animal and plant proteins. Lower intakes of animal protein and higher consumption of plant protein has been positively associated with improved fertility. Each day, aim to include half of your protein sources from plants and the remaining from meat, with only occasional red meat. So rather than a full vegetarian diet, it is a flexitarian approach. An easy way to do this is to halve your meat serve and incorporate a plant protein in its place. For example, if making a stir fry, decrease the amount of meat you include and add some beans or nuts. Or you could include some beans at your lunch meal, for example baked beans, and leave your evening meal for the meat serve. Speak with your dietitian for ideas about serve sizes or look at the Eat for Health website using the URL on your screen. Now is a good time to assess how much alcohol and caffeine you are consuming. The large Nurses' Health study provided very clear results around all of the food choices we have just discussed. However, there was no clear resolution about at what level the consumption of alcohol and caffeine affects fertility. We do, however, know that caffeine and alcohol should both be limited once you are pregnant, so now is a good time to reduce your consumption of these. Limit caffeine to 1 to 2 serves per day and avoid alcohol completely. Iodine and folate are the two important supplements to take when planning a pregnancy. Folate is needed for healthy growth and development and reduces the chance of neural tube defects like spina bifida in a baby. Women trying to conceive should take an extra 400 micrograms of folic acid per day. The best way to get this is from a supplement. It is important to take this at least 1 month before and 3 months after you become pregnant. Iodine is a nutrient we need in very small amounts. It is a part of thyroxine, a hormone of metabolism, growth, and development, especially of a baby's brain. Studies show the Australian population is mildly iodine deficient, and we need extra iodine when pregnant and breastfeeding. So guidelines advise all women planning a pregnancy take a daily supplement that contains 150 micrograms of iodine. You can take your supplements as individual tablets or as a pregnancy multivitamin. You still need to eat foods that contain folate and iodine. Your best sources are fruit and vegetables, as well as breads, grains and cereals, and fish for iodine. Don't forget nature's supplements. They are excellent sources of iodine, folate, and other vitamins and minerals. Aim for 2 serves of fruit and 5 serves of vegetables every day to help ensure you get all the nutrients you need to help you prepare your body for pregnancy. Check out the Go for 2 and 5 website for tips on how to add extra fruit and veggies to your day.
Are you above your most comfortable or healthy weight? Being in the healthy weight range gives you the best chance of falling pregnant and having the healthiest pregnancy possible. However, the good news is that research shows that achieving a loss of just 5 to 10% of your body weight, whatever weight you are now, has significant effects on fertility. For many ladies, this is as small as 4 to 6 kilos. Mindfulness, non-hungry eating, and the questioning approach. The language we use around food can have a big impact on how we think and feel about what we eat. It's important to remember that food is not good or bad. Food's not a moral issue. More appropriate terms are everyday food and sometimes food. If we think of foods as good or bad, when we eat the so-called bad foods we feel guilty. So practicing morally neutral terms for foods will increase our positive language and encourage us to look at foods in a more appropriate way. If you know it's okay to have it, it's much easier to eat more slowly. You usually enjoy your food more and you end up eating less. Dr. Rick Kausman, the pioneer of the if not dieting approach to healthy weight management, teaches us that one part of the weight loss puzzle is recognizing and reducing non-hungry eating. Non-hungry eating is eating when you're not physically hungry for food. Often we eat foods because we're emotional, tired, or eating without thinking. Our reaction to food is often instantaneous without awareness or thought. Some non-hungry eating is normal and many people do it. When we end up doing a lot of non-hungry eating, it can be hard to maintain a comfortable weight, and it may also contribute to weight gain. Practicing asking yourself some questions can help identify non-hungry eating and help reduce its influence on your weight loss goals. Do I really want it? Asking yourself this question can make a big difference to the amount of non-hungry eating you do. Practicing responding to this reaction with a question that raises your awareness of whether you feel like it or not will help you get better at not eating things you don't really feel like. Other questions may help you decide if you really do want something. Am I hungry? This takes time to really assess. If you're not used to using the questioning approach, but you'll find your awareness increases with time and practice. Am I really enjoying this? Could I say no? Could I stop now? Have I tasted what I just ate? It's hard to taste food if focus is elsewhere, like in the car, watching TV or at the movies. Is this meal or snack helping me feel more comfortable and healthy? If not, could I choose an alternative? Am I treating my body like a rubbish bin? Once you're not hungry anymore, whether you throw it in the bin or in your body is no different. The only difference is that if you use your body, it will slow down your weight loss and slow you down from getting to a more comfortable weight. Have I had enough water today? A good goal is at least 8 glasses. Remember, it's all about practicing asking yourself these questions. Speak with your dietitian about other techniques to try, or check out the URL, if not dieting, on your screen for more information on non-hungry eating. Do you do 30 minutes of physical activity on most days of the week? Regular, moderate and vigorous physical activity helps maintain a healthy weight and has many additional health benefits, including lower stress levels, more energy, better sleep, better bowel habits, better mood, less anxiety, and a lower risk of heart disease and diabetes. Do you sit for longer than 30 minutes at a time? Evidence is emerging that being sedentary for long periods at a time, even if we do 30 minutes of activity at some point during the day, can be detrimental to our health and increase our risk of diabetes and cardiovascular disease. What's the general physical activity guideline? To get the most health benefits, a good goal is at least half an hour of moderate intensity physical activity on most, but preferably all days. You don't have to do this all at once. Your exercise can be spread over the day in 10-minute blocks. Try 3 10-minute walks or 2 15-minute periods of activity. What does moderate intensity mean? Moderate intensity means you're exercising at a comfortable pace. A good guideline is the talk test. You should be able to maintain a conversation easily without being short of breath. It's okay to do more vigorous activity if you like. What stops you from exercising? And what makes it easier for you to exercise? Think about your answers to these questions and use them to help you decide the best activity for you. If you haven't exercised for a long time, or if you're very busy, or find the idea of starting an exercise program daunting, then a great place to start is by increasing your incidental exercise. Incidental exercise means looking for opportunities to move your body during the day when you might otherwise take the easier way out. Take the stairs rather than the lift, or hop off the bus one stop earlier, or park further away and walk that little bit further. Wearing a pedometer and recording the number of steps that you do each day is a great way to challenge yourself to move more. Breaking up your sitting time is also important. Don't sit for longer than 20 to 30 minutes at a time. The next important connection to make is to incorporate exercise into your day-to-day life, so you can do it with as few changes or disruptions in your routine as possible. You need to set your life up for exercise so that it's a normal part of your day, a routine just like brushing your teeth. Don't rely on willpower, because willpower runs out. Instead, schedule specific times during the week to exercise. Then protect that time just as you do with other important things like a doctor or a dentist appointment. Use an exercise diary to help with motivation and keep you on track in the early days. At today's visit, you'll be asked to complete a short questionnaire about your dietary habits. This will help us understand your nutritional needs and identify whether you may benefit from seeing one of our specialist fertility dietitians for further individualised advice. Alternatively, if you would like further information about anything you've heard today, speak with your doctor or midwife about a referral to see one of the Mater Mothers Hospital specialist fertility dietitians. We look forward to working with you to tailor your diet and exercise to help optimise your fertility.